It's Thursday, March 19th, and this is now on HNN.
The FDA says an anti-malaria drug could help with the fight against coronavirus. I'm Skyler Henry at the White House as the Trump administration keys in on $1 trillion stimulus package.
Normally you pay a lot of money to get things going. Here's a case where we're paying a lot of money to stop things because we don't want people to be together.
And this is a strong action.
Here at home, the city closes parks and other attractions as it prepares for a broader shutdown.
My temperature started to rise.
Actor Daniel Dae Kim says he's tested positive for COVID-19.
For the nation's senior citizens, it's a dual threat, both coronavirus and the danger of social isolation. I'm Niti Chen with advice from experts.
Guided by the spirit of aloha.
These stories plus Tulsi Gabbard is suspending her presidential campaign. We'll tell you who she's endorsing coming up on This Is Now.
Good morning. Thanks for watching This Is Now. I'm Jonathan, your director producer, alongside Ashley here. We have some news just into our newsroom. The State Department has issued a travel advisory urging Americans not to travel overseas.
So the Level 4 advisory issued this morning advises U.S. citizens to avoid all international travel due to the global impact of COVID-19 and says U.S. citizens who are currently overseas should arrange for an immediate return to the United States unless they are prepared to remain abroad for an indefinite period. Meanwhile, President Trump is pushing his administration to fast-track an anti-malaria drug as a possible coronavirus treatment. The Senate is also moving forward with a measure that could send checks directly to Americans in need. Here's Skyler Henry.
Well, thank you very much.
President Donald Trump went to FEMA headquarters, where he held a conference call with the nation's governors on the coronavirus response.
A lot of progress is being made, so I look forward to speaking to the governors.
Earlier, the president announced he's directed the FDA to fast-track testing an anti-malaria and arthritis drug called chloroquine.
It's shown very encouraging, very encouraging early results.
That's a drug that the president has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients.
The FDA commissioner says an anti-Ebola drug is also being looked at, but adds that a coronavirus vaccine is still a year away. The Trump administration continues to negotiate with Congress on a third-phase coronavirus bill that could come with a price tag of $1 trillion.
Money for people, from the middle class on down, period.
Direct checks to many Americans is part of the plan. Treasury Secretary Steven Mnuchin says it could include a $1,000 check for each eligible adult and $500 per child. Also part of the proposal, grants for small businesses, funding for healthcare centers and equipment, and loans that must be paid back for hard-hit major industries. Democrats say big businesses should not be allowed to use taxpayer dollars for stock buybacks.
There needs to be conditions to make sure the interests of labor are given priority, that corporations can't buy back stock, reward executives, or lay off workers.
President Trump has indicated he could support legislation that would ban stock buybacks. Skyler Henry, CBS News, the White House.
Now, another celebrity has contracted COVID-19, this time one with a local connection. Former 5-0 actor Daniel Dae Kim says he has tested positive. He posted a message on Instagram earlier today from here in the state. He says he was in New York recently when he was playing the role of a doctor who gets recruited actually to play a doctor helping with a pandemic, ironically. That's when he found out the production was suspended and he began to fly home. And that's when he realized something was up. Let's listen to what he had to say.
Now, it's important for you guys to know that I was asymptomatic during all of this time. But as the flight was close to landing, I started noticing some scratchiness in my throat, which is unlike how I usually get sick. So when I landed, I called my family doctor in Hawaii, and he told me to monitor my symptoms. To be safe, when I got home, I quarantined myself in a room in the house and tried to rest on my own. But later that night, I started feeling tightness in my chest, body aches, and my temperature started to rise. So he then told me to get tested.
Now, Kim says he got tested at one of those drive-through facilities here in town. He also says he never went to the hospital and didn't need to. He's still on the road to recovery, but he says he's pretty much close to feeling 100%.
It's interesting the different symptoms people are experiencing.
The range is so wide.
Yeah.
Some people just a cough, slight fever, and then some people so severe and tragic.
Right.
All right, let's move on to some other news from here at home.
Right. Meanwhile, the statewide total of cases still stands at 16. Here's the breakdown by island. Oahu has 10, Maui has 3, and there are 2 cases on Kauai and 1 on Hawaii Island. Now, Honolulu Mayor Kirk Caldwell signed a supplemental emergency proclamation ordering all bars, clubs, and restaurants to halt dine-in service starting tomorrow at 8:30 a.m. Now, takeout, drive-through, and delivery services are allowed. Honolulu police say they could cite or even arrest business owners who do not comply.
All right, we want to talk about something else, and that is the city beaches. Mayor Caldwell came out yesterday and said they were shutting down. There was a little confusion about how exactly that would take place. Casey Lund went searching for answers this morning. He filed this report just hours ago.
The crowds were certainly a little bit lighter this morning than they usually are here at Magic Island inside Ala Moana Beach Park, but you could still see folks out enjoying the water, even some of them hanging out on the beach and scuba diving. The city can't stop you from going into the water. You are able to cut through the park and access the ocean. Their jurisdiction ends at the high water mark, but the confusion came on when those park closures go into effect.
He says the park is closed for now, I guess, and everybody's got to leave.
Around 7:30 this morning, HPD made their rounds and announced over their PA systems that the park was closing. But the mayor's proclamation announced yesterday reads more like parks will close with dine-in services at restaurants on Friday morning at 8:30. Despite any confusion, the city's parks department says today is the day.
My problem is that people should be outside in the fresh air, sunlight, and people aren't bunched together, as you can see, as you've seen this morning. And there are hundreds of people out here, many of them seniors, and seniors need this.
Seniors like Lehua McColgan.
But on a public beach like this, I don't think they should close it. You know, they shouldn't close it at all. Because people come down here to exercise, like myself. A lot of exercising down here. And I've been doing this for years.
She comes here 5 days a week to swim. At 94 years old, it's getting more difficult for her to even make it down to the water. If her son isn't able to park in the Magic Island parking lot, she doesn't have a lot of options for beach access.
It's really going to affect me because I want to come to the beach every day, and that's my exercise. That's what's keeping me alive.
What do you think life will be like if you're cooped up and you can't get out here?
I wouldn't be here for the rest of my life then. I'll be gone. But my mother told me as I was growing up, go to the ocean. The ocean water is healing. So I remember what she said, and I go to the ocean water.
The city says the order is meant to keep people from gathering in large groups and noted that people could be cited for disobeying the mandate. At Magic Island, I'm Casey Lund, Hawaii News Now.
And this morning, we're getting a better idea of the emergency rules in place for Maui County residents. Mayor Mike Victorino says sheltering in place is greatly encouraged. The exceptions are for essential activities, which include going to the doctor, grabbing supplies, and caring for a family member. You can also go outside to walk, hike, run, or golf, but the county says you need to maintain the 6-foot social distancing barrier. Essential businesses are staying open. Those include healthcare and childcare facilities, grocery stores, banks, pharmacies, gas stations, auto repair shops, and hardware stores. Restaurants and cafes are takeout only. Now, parks, gyms, bars, theaters, and tourist attractions are shut down, and gatherings of more than 10 people are banned. And starting tomorrow, Kauai residents will be under a mandatory island-wide nighttime curfew. Kauai Mayor Derek Kawakami says every individual within the county of Kauai must remain in their residence from 9 p.m. to 5 a.m. daily until further notice. He's also asking visitors to stay away.
I want to make it clear, as mayor, I realize that many of our residents need to travel for health and medical reasons. But until further notice, visitors should not be traveling to our island for recreational purposes. Kauai is on vacation.
Now, there are exceptions to the curfew: people commuting to and from work, essential employees, those delivering food and household supplies, and those seeking medical attention. Now, under the emergency rule, homeless individuals will be allowed to shelter in place, and they are urged not to move during curfew hours.
Now, a much different story on the Big Island. That's where Mayor Kim tells us he's just leaving it up to the businesses to decide whether or not to close. We talked to him on the phone last night to get an update, to get some clarity there. Let's listen to what he had to say.
I'll tell you what is happening statewide is a fear factor that's very bad for all of us. To say close because you have over 10 or 15 or 20 people is more detrimental than anything else. But to balance that with be careful, pay attention to social distancing and cleanliness, disinfectedness, I think is a good way to go for us. Not saying this is for the rest of the state, but this is how we're evaluating things right now.
All right, Mayor Kim says a county task force will help companies that may be struggling to stay in business. All right, we got some news just into our newsroom. UH has said they are canceling the traditional commencement ceremonies at 10 campuses. So graduation ceremony is off, folks, for those seniors. I know that's some disappointing news. Officials are encouraging students to think of a moment as delayed. Think of it as delayed and not a loss. And that students would be able to walk in a semester ceremony and have an opportunity to participate in person when it resumes, everything resumes. Right. So they're saying, even though you don't get to walk in the spring, there will be a time in the future where you will get to walk. I know that's some very disappointing news there. We have a coworker in our newsroom, our managing editor, said he picked up his daughter who just came home from school on the mainland. When he picked her up, she was in tears because she had just found out she's missing all that stuff.
Oh.
I know. All right, let's get some checks of the world headlines.
Yep, so Gwen Baumgartner reports on how the coronavirus is impacting other countries around the world.
A sign of solidarity lit up the sky in Rio, with Brazil's famous Christ the Redeemer landmark displaying all the countries grappling with the growing pandemic. In cities across China, buildings projected tributes to hospital workers fighting the coronavirus on the front line. This man says, "I'm so moved to see these photos. I know exactly who they are." Japan's deputy prime minister calls the upcoming Summer Olympics cursed. The torch handover ceremony went on in the Greek capital Thursday without spectators. Here in London, where the virus is spreading faster than other areas of the UK, parts of the subway system are shut down, with more and more people working from home. Those without childcare are getting creative. These dads are using their babies in their outdoor fitness routines. More countries in Europe are feeling the strain of the virus, with cities enforcing curfews. France is on total lockdown, and police have issued more than 4,000 tickets to those ignoring the mandate. Across the globe, people are helping how they can. In Ukraine, seamstresses are stitching thousands of face masks with gauze donated from local pharmacies. And in India, a police video has gone viral, with officers donning face masks and dancing to highlight the importance of hand washing as the fight against the coronavirus goes on. Gwen Baumgartner, CBS News, London.
All right, we got a picture just into our newsroom. This is of the Queen of England, Queen Elizabeth. They're arriving back at Windsor this morning. She has a message to the citizens of the world, really. Her message is saying we have a vital, important role to play as individuals. Her message that she delivered this morning says, at such time as these, I am reminded that our nation's history has been forged by people and communities coming together to work as one. You know, she's been through so much in her reign as queen. She saw World War II. The Blitz that happened there in England. She's really seen a lot. Her message went on to say, many of us will need to find a way of staying in touch with each other and making sure that our loved ones are safe. That's the Queen of England there speaking.
Yeah, and in China, officials say they are reporting only 34 infections in the past day, mostly people arriving from overseas. Now, even though their outbreak is far from over, CNN's Stephen Jiang says China holds valuable lessons for other countries.
Much has been said about China's Herculean and sometimes brutal efforts to contain this virus within its borders. These measures, of course, have included locking down millions of people to their homes for weeks, mass roundup of suspected cases in the epicenter, as well as the tracking of everyone's health condition and travel history nationwide using big data. A lot of these measures have serious human rights implications. That's why people say they cannot be easily replicated in the rest of the world. However, what we are already seeing is governments around the world, including the U.S., adopting some of these policies, at least in some form. We are talking about citywide or region-wide lockdowns, travel restrictions, mass closure of businesses, mass testing, as well as obsessive health checks. So analysts say, just like not all of China's failings are due to its authoritarian system, not all of its successes are due to its political system. So once you remove that prism, what you are seeing right now in the West, in many other countries around the world, is the kind of mass mobilization and extreme policies we have seen in the past during wartime. And this global pandemic, of course, is very much a war. That's why I think one saying I have been hearing lately is very much relevant here. That is, wartime democracies, or efficient, effective, and fearsome things. Now, at the same time, the Chinese authorities here are increasingly concerned about imported cases, and that's why you see officials nationwide, especially here in Beijing, take increasingly stringent screening and quarantine measures targeting international arrivals. Here in Beijing, with a few exceptions, everybody from abroad now has to go through this mandatory 14-day quarantine at a government facility at their own expense. No more self-quarantine at home. The authorities here are also increasingly cracking down on people who try to lie about their medical history or travel history in order to sneak in. They have actually launched several criminal investigations into people who have allegedly done so. They're also telling Chinese nationals living overseas not to rush back unless there is an urgent need to do so. But of course, that is a tall order considering how things continue to get much worse outside of China while the situation seems to have been brought under control inside of China. Stephen Zhang, CNN, Beijing.
All right, let's move things back to here at home. You know, a face we've seen a lot in this crisis is Hilton Raethel. He's the Healthcare Association's, the lead there over there at the Healthcare Association of Hawaii. He was on Sunrise this morning in our studios, and he was talking about the status of our ventilators. A lot of people concerned about that. Let's listen into that conversation.
Now, just starting off, we have heard so much about whether or not we have enough ventilators. What is our supply like?
Well, currently in Hawaii, we have about just over 3,000 licensed beds across the state of Hawaii. That is in our acute care hospitals. We have about 340 ICU beds that are part of that 3,000 total bed count. And we have about 540 ventilators right here in the state now.
You know, Hilton, we have 16 confirmed cases. Some speculate that the numbers are much higher, and we know that it could rapidly ramp up. Are we prepared in our hospitals, in our nursing homes, in our hospices?
We are preparing to deal with all sorts of eventualities. Starting on Monday of next week, every hospital across the state will be reporting some vital statistics, and we will be tracking those statistics, plotting those and putting those into models that already exist across the country, across the world actually, based on what is happening in other countries, to look at the trajectory and to look at how much we need to plan. We're already working on contingency plans, utilizing both state and federal resources to expand our capacity. So that type of planning is in the work right now.
Hilton, will those statistics include the number of confirmed cases and how many people are being tested?
Absolutely. We are tracking. The types of things we'll be tracking will be the average daily census, how many of our ICU beds are occupied, how many of our ventilators will be used in any given day, how many infections or cases with infection that have been admitted in the past day, and will be tracking the number of tests done each day and the number of positive results back. So all of those statistics will be collected on a daily basis starting on Monday of next week and put into those models. And there's already some very good models out there that have been developed by Johns Hopkins and other organizations, and we can look at what's happening in other countries and in the US, and then say, what do we expect to have happen in Hawaii? Because our goal, working with the governor, working with HIEMA, working with General Hara, and the Department of Health, is to get in front of this and to do everything we possibly can to protect the people of Hawaii.
At this point, in the past week, we have seen a huge ramp up, at least an effort to ramp up the number of people tested. In your opinion, is it difficult to try to get a test? Because I know just anecdotally, sometimes people say that they want to be tested, but they haven't been able to be.
Well, in terms of testing, there needs to be a valid reason for people to be tested. So you either need to have symptoms, and there are specific symptoms that are associated with COVID-19, so you have to have those symptoms, or you have to be exposed to someone who has the symptoms or who has a disease, or being in an area where there is a disease. Now, if you meet those criteria, the symptoms for COVID-19 are very similar to the flu. And the flu is much more prevalent right now. So even if you have those symptoms or have had potential contact, we need to rule out the flu. And then if you meet all of those criteria and a doctor's order is required, then you will be screened for COVID-19. Now, if someone does meet the criteria for screening for COVID-19, they should self-isolate until they get the results back, which will take 3 to 4 days right now because most of the labs have to go to the mainland. So there is a consequence to being tested. And there are testing sites across the state of Hawaii. We are updating the information literally on a daily basis as information changes. So there are testing sites across the state of Hawaii, and that list is on the Department of Health website.
You know, we already have a huge shortage of doctors here in Hawaii, and I'm curious about the number of beds because when you look at the statistics and the models of how high the numbers could potentially be, you know, we're hoping to flatten that curve. If that doesn't happen, are there plans in place? Are there enough beds? And if not, are there plans in place to help out with that?
Well, we're very fortunate in Hawaii that overall we have a very healthy population. We have some of the lowest utilization rates in the country in terms of emergency revisits per 1,000, in terms of hospital admissions per 1,000. So, and that's wonderful. But what that also means is that our bed capacity is geared for a normal, typical, healthy population. So there is a finite number of beds. But, however, we are working on 2 levels of contingency plans right now. The first level is looking at what surge capacity we have in the state right now. So we are collecting information from all of our hospitals and all of our resources to say, what type of surge capacity do we have in the state? Now, one of the limitations with our surge capacity is human resources, and some of our hospitals are already reaching out to the mainland or to other parts around the world, other countries around the world, to say, can we bring in some additional healthcare workers? Because we may have bed space, we may have beds, but we may not have enough healthcare workers. So there's that state level of planning we're doing, and we're also working with HIEMA and the Federal Emergency Management Agency, FEMA, to look at what federal resources we can tap into as well. For example, we placed an order for personal protective equipment on Friday of last week, and we received that delivery on Monday of this week. Now, we did not get everything that we asked for, but we did get literally thousands of items of personal protective equipment, actually a few pallets worth. We are placing additional orders, and we are assessing what we need to do. And again, we're utilizing all potential state resources and tapping into federal resources as well.
Hilton, I got to ask you, you know, the majority of our population may be on Oahu, but is the population on our neighbor islands more vulnerable because they tend to have a lower capacity of doctors, of staff, of beds in general?
We do have challenges, as we know, on the neighbor islands as well, but we are working on a daily basis with all of the healthcare providers across the state on all islands to help them, to support them, to supply them with equipment. So we can flex. If there were to be an outbreak in a particular area, the planes are still flying, we can move equipment around, we can move supplies around. So we are monitoring what is going on. And these statistics that we will start gathering on Monday is for every hospital across the state, including all our critical access hospitals, so we can look at what is happening and ensure that we are providing them with as much support as possible.
And as the economic impact of the coronavirus spreads, unemployment claims have soared nationwide. There are reports of state unemployment offices, websites crashing as people rush to file claims. Natalie Brand reports from the White House.
A nurse will come down and evaluate you.
Uncertainty around the coronavirus has spared no city, no industry, from the Las Vegas Strip to auto plants in the Midwest.
This is something we've never faced before, a coronavirus like this.
The Labor Department reported Thursday that applications for benefits jumped by 70,000 to 281,000 last week, the highest one-week increase since 1992. Analysts say the surge likely underestimates the true number of unemployed workers because many states have reported layoff spikes in just the last few days as more businesses and restaurants close their doors or alter their hours.
How are you going to survive? Are you going to pay your bills? How long?
The federal government is allowing states to expand eligibility for unemployment benefits due to coronavirus, and a newly passed relief bill provides increased funding for benefits. But as lawmakers work on a much bigger stimulus package, some analysts predict the U.S. could still see several million jobs lost by summertime.
We have to keep employers on their feet. We have to keep those jobs open. And so the biggest thing that we can do is support employers as they support their employees.
Workers who remember the rough times of the Great Recession
You just have to come back. We come back from 2009 and we'll survive this.
are holding out hope this too will pass. Natalie Brand, CBS News, Capitol Hill.
We're all in this together. That's the message from the First Lady of the United States. Melania Trump issued, well, she shot a PSA, and it's going to start airing in certain places soon. I'm going to play it out for you.
Today, I want to speak with you about coronavirus and what it means for you and your family. While changes need to be made now, this is not how we will live forever. Our children will return to school, people will return to work, we will gather at the places of worship, concerts, and sporting events again. I urge you to stay connected to family and loved ones through the video chats, phone calls, social media, and other safe technologies. Please be sure to follow CDC guidelines, which can be found at coronavirus.gov or cdc.gov, along with other information and resources. Stay safe. And remember, while many of us are apart, we are all in this together.
PSA there of Melania Trump just issued that today. We'll get back to our coronavirus coverage in just a moment, but we want to get to some other developing political news.
That's right. Hawaii Congresswoman and presidential hopeful Tulsi Gabbard announced this morning that she's dropping out of the 2020 race. Gabbard also revealed that she's backing former Vice President Joe Biden.
I'm confident that he will lead our country guided by the spirit of aloha, respect, and compassion, and thus help heal the divisiveness that has been tearing our country apart. So today, I'm suspending my presidential campaign and offering my full support to Vice President Joe Biden in his quest to bring our country together.
Now, in 2016, Gabbard quit as the vice chair of the Democratic National Committee in order to support Senator Bernie Sanders' bid to the White House. She called him a friend in her email to supporters today. His campaign has been struggling in recent weeks. Meanwhile, it's unclear what Gabbard will do next. She previously announced that she will step down from her seat in Congress when her term ends.
All right, I want to take you live outside. We're taking a live video feed in of our traffic cameras. That's the H1 going through town. Looking a little light out there, I'd say. Like a lot less traffic on the road. Taking you outside because I wanted to see what the weather looks like. A lot clearer than it's been in the past few days. Let's get a check of how everything's going to shape out for your weekend. Here's Guy Hoggy.
Aloha, on this Thursday, the flash flood watch has been extended until early tomorrow morning, except for the Big Island. They're out of the threat for heavy rain, although flooding is possible from Kauai to Maui today with some spotty thunderstorms and some bands of heavy rain. And that's just what we have down to our south. Now, over the last hour or so, the thunderstorms have kind of decreased. Still, though, it's a big mass of moisture slowly moving towards Oahu and parts of Maui County. And the moisture envelope stretches well past Kauai. So Kauai could get some heavy rain later later on today as the disturbance kind of wobbles to the west and to the east. So for today, we'll likely see that threat linger for more flooding, especially for Kauai, Oahu, and Maui County. Drier conditions as that disturbance pulls away by tomorrow. East-southeast corner winds will linger through Saturday, but by Saturday, we'll see fewer showers, namely windward and Mauka showers that will continue all the way through Sunday. And then starting on Monday, breezy trade winds take over. Keep it here in Hawaii News Now for your latest on the severe weather.
Thanks, Guy.
And as the coronavirus brings normal life to a screeching halt, America's seniors are facing a dual threat. They are the most vulnerable to the virus, but also most vulnerable to social isolation, which is a public health crisis in itself. Here's Nancy Chen.
Mark Merity has dedicated his career to helping the elderly. The coronavirus forced him into a wrenching decision.
When I informed them that we were suspending the program, there was just an audible sigh in the room. Many of them either never married or don't have children, or their partners and spouses are no longer living.
Merity is director of the nonprofit DeRote. Its entire mission is preventing social isolation among senior citizens with both on-site programs and home visits. But COVID-19 is most deadly to the elderly and those with underlying health issues.
If we were having thousands of volunteers visiting with seniors in their homes, although they're doing a tremendous service, we're also putting the seniors at great risk.
According to a study sponsored by the AARP Foundation, a quarter of the country's senior citizens call themselves socially isolated. And with more than 50 million Americans over 65, that means loneliness is already a crisis.
Where they are lonely, that's where we really worry about increased risks of depression, and unfortunately suicide is also a concern. Older adults have very high suicide rates.
In California's lockdown Bay Area, Bruce Bell misses his visits to the public library.
That's what I did on my bike. I rode my bike to these libraries, you know. That sort of outlet is gone, you know, so I don't know what I'm going to do.
Merity says the best way to help the nation's seniors right now is to stay in touch, not by text or email, but by picking up the phone and showing some love. Nancy Chen, CBS News, New York.
Now, the European Union wants video platforms, including Netflix, to slow down streaming during the coronavirus pandemic to keep the internet from crashing. Officials are asking the platforms to stop showing video in high definition. Hundreds of millions of people are working from home and even more children are out of school. The result has been unprecedented internet usage and intense strain on bandwidth.
I gotta say, and it's something that I've been thinking about, and I sort of felt that way yesterday. I'm wondering, with everyone using the broadband and all the internet, is it going to slow down here?
Right.
I mean, we
have
really
you experienced any?
I felt like yesterday I did, but you know, sometimes it's hit or miss. So
Right.
I can't contribute that to more people being online, to be honest. But it's something I'm thinking about and worried about for sure. Next entertainment story I want to get to, Conan doing something really different.
Yeah, with iPhones and Skype, late night host Conan O'Brien is going back on the air. O'Brien says he will resume putting out new episodes of TBS's Conan on March 30th. His staff will remain at home, and the show will be cobbled together with O'Brien on an iPhone and his guests via Skype. Now, the late night shows have all shut down production due to the pandemic to avoid congregating live audiences and large TV crews. Some hosts have pumped out web videos. That includes Jimmy Fallon. He produced a 10-minute at-home show for NBC's Tonight. Jimmy Kimmel, Stephen Colbert, and David Spade have all given monologues from their homes.
Yeah, I've been noticing that a lot, just the way that TV and television is changing. Even us, like you look at us right now, we're practicing our distance, physical distance from each other, to just make sure we're practicing what we preach here at H&M. We're doing it on all our shows, getting that distance. You saw on Sunrise earlier, Grace was in a different room from her interview.
Yep.
Well, this is a change of life for everyone. We just wanted to share with you some of the things we've been seeing. I've been in contact with my sister in Illinois. They're in DeKalb, Illinois, and she sent me these photos. These are my nephews. They are out of school, of course. All school is canceled there as well, like many other places. There's Byron and Jack on the left there playing their video games, not doing their homework, but I'm told the little one, Jack, got sent his homework for the week on Monday and already did most of it.
Oh, good.
So he's got a bunch of free time. Byron there in his baseball uniform. Of course, they're not playing baseball, but my sister said he's put the uniform on twice just to make sure it still fits. He is a big baseball fan. He does a really good job. And of course, the little dog there, their dog up in the corner, said never been more played with and well fed. And then that's their neighbor in the corner, Eliza. She's built this big tower of things with her toys. That was actually, she's in kindergarten. That's an assignment from her principal to make a tower. And then her other assignment was the day before to do a trick shot. And in the spirit of that, Ashley, will you hand me that trash can behind us, please? Yes, getting my... All right.
Am I holding
You ready?
it?
Yep. Ready? Okay, let's see if we got anything. Ready? Whoa, oh. No? Did it make it?
Well,
Oh, thank you. That's all you need is a little help, right? That's what friends are for. All right, that's my trick shot, Eliza. Yours is probably better than mine. And Ashley, you had something you wanted to show us as well.
Yeah, so I posted this on Instagram yesterday. So I'm a client at the Bar Method. It's this workout studio, and so they closed the studio down to help prevent the spread of the virus. So yesterday they had their first online class for clients on Facebook Live. And so when you do Bar Method, you have a ballet bar, they provide you weights, they provide you a ball, a mat. So obviously I don't have those things at home. So a lot of us use chairs or tables for the bar, and then we had weights. I used wine bottles.
I was wondering what the wine bottle was for. I was like, wow, that's
I
quite
didn't
the
drink the
workout
wine,
there.
you guys. I use them as weights. But yeah, people using all kind of different stuff, and it's actually really fun. And I got a great workout in, but I did miss, the social interaction that comes with the class. I love the ladies that I take bar with, and nothing can replace that.
And actually, my assignment when we leave here today is to go out and capture some photos of just how our city has changed over the last days and weeks. And I'll share those with you in our newsletter we send out at 4 o'clock. You have an update coming up at 3 on our H&N digital platforms. If it warrants, we'll bring that to you on TV as well. But that's going to do it for today, guys. On This Is Now, I'll be back tomorrow. Ashley will be back on Monday. We'll see you then.